November is Diabetes Awareness Month, and with African Americans, 13% more likely to be diagnosed with type 2 diabetes. It is imperative, of course, that we discuss methods to retreat and possibly reverse type 2 diabetes. There are experts from both the medical world and the fitness world that have seen a reversal in type 2 diabetes in patients. Joining us in the studio to talk about this is, at medical standpoint, Dr. Wanda Dyson, an area doctor here, and also Tremel Smith as a trainer out of Atlanta. He is, of course, a fitness expert as well. All right, so Doc, first and foremost, so explain this diabetes reversal, because for so many years we've heard once you get it, that's it.
Well, not necessarily. Type 2 diabetes is permanently reversible if we make permanent lifestyle changes.
Okay, so first of all, how many diabetes are there?
There's type 1 diabetes, which the pancreas doesn't produce insulin at all, and there's type 2 diabetes where the insulin is produced, but it doesn't work properly to drive the glucose inside the cells.
And are folks more likely to get type 1 or type 2?
They're more likely to get type 2 diabetes.
Okay, we also have juvenile diabetes, right? So basically, there are typically three forms we talk about.
Usually we're talking about juvenile diabetes, we're talking about type 1.
Okay, got it. All right, so type 1 and type 2.
Yes.
So we talk about reversal, that's with type 2, not with type 1.
Yes, that's
Okay.
type 2.
All right, so let's say somebody is diagnosed with type 2 diabetes. Okay, all right, and they are, I think Sherry Shepard talked about this when she said that she, I think one time when she tweeted, she says, I no longer take my diabetes medicine. She dropped a lot of weight, changed her diet, and also fitness. Is that what we're talking about when we say reversal?
Yes, that's what we're talking about. We're talking about permanent lifestyle changes, and the emphasis is on permanent. For over 20 years, I've been doing this in my practice, and I find it easier to tell people what to eat rather than what to avoid. So I give them a food list, which includes protein requirements for weight, low glycemic fruits and vegetables, which don't raise the blood sugar as much, and good fats.
Let's start right there. So what is a low glycemic fruit? Give me the actual fruit, because I already know what low glycemic is.
It's all Googleable, but apples, pears, cherries, things of that nature. And the vegetables are mainly green vegetables. We think of broccoli, kale, dandelion greens, romaine, etc.
So we hear bananas, but bananas are also sweet. So
bananas don't really make the list.
Okay, don't make the list.
And I don't agree with the American diabetic diet at all. I've been doing this for over 20 years in my practice, and the patients that follow my advice don't need medications for type 2 diabetes.
So no insulin shots, no pills?
If they, keyword, follow. If they follow my advice, they don't need it.
And how many folks are we talking about? I mean, that you treated, that you have been able to get them to, once they listen, to reverse?
That's key. Hundreds, and I've been in practice for nearly 30 years. And initially I practiced in the medically underserved areas of Washington, D.C., which I found was the toughest group. I had to actually bring people in to educate them on nutrition and show them actually how to prepare food that was healthier for them.
Tremel, let's go to you. Obviously, fitness plays a part in this as well. And so what role do you see? What's your job in all of this?
First of all, I agree with Dr. 100%. The nutrition is going to be the first key to getting diabetes in control and reversing it. I'm a huge proponent of adding fat to the diet, as well as the low glycemic fruits and vegetables and high fiber as well. But my role as a personal trainer is to provide more muscle, more cardiovascular health to my clients, because the inclusion of muscle and the loss of fat definitely helps the body become more insulin sensitive and better control glucose.
And so what are you recommending in terms of exercise? Is it every day? Is it 3-4 times a week? Exactly what?
I recommend at least 4 days a week. And I also like a combination of both cardio and resistance training. It has been proven to show you get better results with the inclusion of both of those and not just one or the other.
Doc, sleep plays a big part of this. Explain why.
Yes, African Americans tend to be short sleepers, and by short sleepers, I mean we sleep less than 6 hours. When we don't get enough...
6 hours? Man, that's a long time. Well, somebody who averages about 4.5.
Not good, not good. So when we sleep less, the decision-making part of our brains don't work as well, which causes us to make poor food choices. We will tend to eat pizza, donuts, burgers, and drink very sugary-laden drinks.
Some of us eat all that. We just sleep 8-10 hours. But also explain, though, how sleep helps you process. I mean, how it helps your body process what you do eat when you're eating the good stuff.
Well, it's necessary for processing sugar. So if we sleep only 4.5 to 6 hours, our glucose is not under control. We don't process sugar as well.
Question?
Well, as I guess the resident diabetic here on the panel, type 1. I agree with you.
Yeah, normally they're running your mouth. As a resident young person, yeah, come on.
Look, I agree with your diet. My endocrinologist told me something similar.
You got diagnosed what age?
20. I was 2 weeks away from 27. Well, 26. Yeah. This last year.
He been eating real bad for a long time.
But we made some good adjustments.
Type 1 diabetes is different. It's
My
not
dad's
necessarily
also type 1
related to
diabetic.
diet.
Yeah.
But he been eating real bad.
He's
Go
been
ahead.
eating me bad.
Don't try to blame it on me.
Well, my dad's also type 1 diabetic. He had juvenile diabetes at 13. But my endocrinologist told me, something very similar. Heavy on meats, not so heavy on carbs. When it comes to the fruits, try to stick with your less juicier fruits. They typically have more sugar. It's more solid fruit, less sugar. So I agree with you.
Yeah. Many endocrinologists send their patients to me because they don't understand how to get their diet under control.
Yeah.
How long does it take to see a change after the dietary change?
Probably within 6 to 8 weeks, usually.
Wow.
Yeah. I had a friend who was diagnosed with diabetes, and her blood sugar was like 900. She was hospitalized.
Wow.
They automatically put her on insulin and medications, and she lived in South Carolina.
Right.
So she just drove to DC. I told her what to do. She didn't require any medications, and her diabetes has been under control ever since.
Tremaine, I want to go to you. Is it also important to mix in different types? I mean, some people, of course, get bored to death just walking the treadmill or an elliptical. And so if you're saying do it 4 times a week, what are you telling folks to do to mix it up?
I like to suggest maybe 2 days of resistance training where we're actually lifting weights, doing, things like lunges and squats and things of that nature, pulls, push. And then the other days I also like to recommend that we do cardio, whether it's running, walking, jogging, swimming, biking, whatever that a person can do that's going to be safe for their joints and that they can fit into their schedule. But definitely the combination of both cardio training and resistance training has shown to do the most in terms of combating diabetes.
Malik, final question.
So I think Tremel, I think with his plan, I'm on track because I just played in my high school alumni game. That was wind resistance training enough for me. But coming from a family that has suffered from diabetes throughout our generations, what are some of the preventative measures that we need to take and enact now? Should we be even having a conversation with you now to help prevent those kind of scenarios?
Yes, definitely. You should be having the conversation right now. My grandmother actually was a diabetic, and she had amputation. And my 45-year-old cousin died about 1.5 years ago, didn't even know she was a diabetic. Wow. And I had been trying to talk to her about her diet and her lifestyle. So I think it's 3-pronged. We need to deal with our diets, our nutrition, and the design of the African American human body is what it is. I don't think the standard American diet works for us. No. So we need the low glycemic fruits and vegetables, heavy on the protein, and adequate fats. We also need to get enough sleep.
When we say heavy on the protein, like what?
It's according to weight. So there's no blanket, one-size-fits-all recommendation for protein. I give the patients a food list, and it has their protein requirement for their weight.
Okay. All right, cool. I think we
You have
can
a
make.
website?
I think we'll make Doc do a
I
food.
do.
Make Doc do, right. So is it on there as well? Do you break it down? So what your weight is? Say this is the diet you should be on.
Not according to weight. I give you the general guidelines, but then
Got
I
it.
can become more specific.
To the person. Yeah.
Because food sensitivities, you may be eating food that you're sensitive to. So that's also plays into diabetes.
I don't eat nothing I'm sensitive to.
You may not be aware.
When you say sensitive to,
Vegan buffalo wings.
you gotta define. You gotta define what sensitive means.
Well, people have food sensitivities that they're unaware of.
Like what's a food sensitivity?
You could be,
Sensitive
you,
to not having
for
enough of it.
for instance, you could be having canola oil in your diet, but canola oil doesn't work for your body, and the cells in your body are reacting to it. And I do that sort of testing in my practice.
I got you. Okay.
Interesting.
Because if I don't like it and they don't smell good, I don't eat it. That's my sensitivity right there. All right, Doc, I appreciate it. Thanks a lot. Tramel, we appreciate it. Thanks a lot as well.
Thanks for having me.
All right, folks, we'll be back. News One Now in a moment.